Good morning, and thank you for taking time to tune in. This will be your EMS division brief. I wanted to update you on a few items that we're working on. We'll start with the CARES program. Shelley will be speaking on her progress in the new role, but I wanted to let you know now that we have this program in place, we have a few options available to us. One being our ability to refer patients to Dispatch Health. We can now seek reimbursement from the Healthcare Authority for Medicaid patients on treating and referring. Captain Lukabaugh later this month will be doing training on that aspect. We are also receiving funding from the Pierce County Accountable Communities of Health which goes towards a reduction in 911 calls and unnecessary emergency department visits. All of this is under the CARES umbrella. Again, Shelley will be talking more about that. She's also been introduced to the skilled nursing facilities, the assisted livings, and the medical clinics so she can begin to educate them on the proper use of 911 using our Make the Right Call document, and then also offering educational services to their staff. Dispatch Health, as of 11/20/2019, we've referred 59 patients. Thanks to your input, we've identified a few issues that need to be addressed. We recently met with Carrie, and she's going to be addressing the call triage system that they're utilizing, which is taking an unusual amount of time on some of the incidents. So they're going to address that. Along with that, they're going to get us what is known as NPS scores, but it's basically a survey to the citizens on how they felt their treatment was. So we'll be able to get a line on how well Dispatch Health is doing when we refer the patients to them. Multi-care off-campus ED, as of October 31st, they have seen 12,381 patients, averaging 72 per day. They've transferred 706 patients out of the facility to either Good Sam or Tacoma General using Northwest Ambulance. And then CPFR units have transported 6 patients out of that facility. Each one of those have been reviewed by either our staff or Dr. Friedrich. On Thursday, Lieutenant Fox will be doing a shadow, a ride-along per se with the Parkland ED, shadowing the medical director to gain some perspective on their patient care issues, along with giving our perspective on how things work in the street. The next scheduled ED to open will be in Bonnie Lake in December, followed by the one on 133rd and Meridian in July. So we'll continue to monitor activity both in and out of each of those facilities. Low acuity transport units, we're still on pace to begin the pilot program on March 1st. The next step for us is to get the dispatched codes to Firecom so they can begin testing. The low acuity work group vetted all of those along with Dr. Friedrich, so we'll be sending those off to Firecom in December. They'll begin the testing, and we'll be ready to go live on March 1st. So the EMS delivery assessment, a draft RFP detailing the scope of the project has been completed and will be reviewed by the deputy chiefs and the fire chief before being advertised. In addition to the strategic plan task force members, a work group will be created to score the vendor proposals that are submitted. Now I'm going to have Shelley talk about her role as the CARES manager, followed by Captain Lukabaugh and Lieutenant Bouchard talking about OTEP and the Pierce County EMS work to include the protocol changes that are coming.
Good morning. I wanted to give you an update on the CARES program, and if you remember, the CARES program stands for Community Assistance, Referral, and Education Services. So we've been up and running since about the middle of August, starting to fine-tune some of our systems, and are working on putting out a chief's directive so that we can tell you what the process is going to be. The goal of the CARES program is to give crews the ability to refer someone for follow-up care. A lot of times when you go on a call, you're not able to resolve all the issues. Sometimes it takes a lot of time. There could be social components to it. And Central Pierce wanted to give you the tools at your disposal so that you could make sure that those patients got the follow-up that they needed. So the process for making a referral will be that you identify a patient or a family that has some sort of need. And that could be something like that there's someone with inadequate caregiving, they don't have insurance, they have mental health issues, they need different kind of caregiving, maybe even an entirely different setting that they're going to live in, because they're not doing well at home and they're having to utilize the 911 system for their ongoing needs and just for routine care. So the process will be that you identify that person and then you will enter a referral into the info portal under the EMS tab, and I will get notified of that, and then I will follow up on that hopefully the next day. You can check back on the info portal under the outcome and progress. I think that's what the last column is, and I'll update as I go along so you can see what's going on with the patient, even if it's after hours. We are going to put an algorithm on when and how to refer to the CARES program on the MDC, so that is in process. If the need is time sensitive, you're going to be able to call me during Monday through Friday from 8 to 5. If not, then you will be able to call MCERT, and again, we're working on a process for that. There is an RFP in progress for a new software program, and I think it's going to be super user-friendly. The crews will just have to check a box, add in a little bit of extra information, and that'll immediately alert me to the fact that there's a new referral. The system is going to tie in with Zoll, with RMS, it's going to tie in with EPCR, and also with the Epic systems, and it will let me know if a patient is case managed by me, if I've selected that for them. It will let me know the next day if they had a 911 call or if anything else happened. I won't have to look up every single patient and wonder if they've been calling. So I think that's going to be really friendly and make a huge difference. I'll have a much wider perspective on what's going on out there with the patients that you've referred. The RFP is in progress. It was advertised last Wednesday. It's going to be advertised next Wednesday. That we're going to close it. By the end of the year, we should have a decision made. And hopefully by first quarter, maybe more towards the end of first quarter, we'll be able to have that system up and running, optimistically. But that is the goal, and the system is running in other places. And so I think that it should be easy to do. Let's see. I think that is all the updates I have. Just to let you know, the new system is going to be able to collect a lot of data. So the more information you can provide when you do make your referral, when you do your charting, would be most helpful.
Thank you for listening to us. One of the things that we're working on right now is a new OTEP plan. How does this affect you? Well, we're trying, number one, is to make an OTEP plan that works across the county is the same one, so that when we turn in stuff to Pierce County EMS, that there's not a, oh, you do it this way and they do it this way. This way we all have a consistent OTEP plan. When will this be rolled out? It'll probably be rolled out July of next year. In the meantime, we have to get it approved at the county level and the state level. And once we got everything approved and it's moving forward, then we'll work with training to see what our OTEP delivery plan will be. It may be a little bit different than what you're seeing now. It may be a lot of the same, but over the years it will gradually change. As I said, we are working with West Pierce, East Pierce, Tacoma, Gig Harbor, even District 16, Key Pen. So we're all trying to make sure that we all stay on the same page to make it easier for the county to keep everything consistent and know that we're all doing the same thing.
Good morning. Last but not least, we're going to talk about some things that we're going to discuss tomorrow at the county level meeting. So November 27th will be a 4-hour block of meetings, which will consist of Pierce County protocol, training and development, operations, and CQI. First thing to talk about is protocol, and some of these protocols will go into effect in January. We're going to talk about the blood product use in the field for transfusion of whole blood. We're going to look at what the protocol looks like for that. We're going to discuss bringing Levofed back, also known as Norepi for pressors. It's pretty dead. Yeah, leave them dead with Levofed. For those of us who've been in the field for quite a while, we remember that. However, now it's pretty extensively used in the ERs. We're going to talk about the vascular neck restraint protocol, of which Central Pierce already has a directive for, but that's going to be a combined protocol with Pierce County EMS and law enforcement. We're going to talk about the mental health transport protocol, which will be based off of the MOA that we already have, but this will be in protocolized form, so you guys will have ready access to verbiage if that becomes necessary. And it'll probably become necessary. Lastly, there's going to be a change to calcium chloride. Predominantly, we're just adding the fact that you should be using calcium chloride for use in blood transfusions. As far as training and development goes, there'll be an OR update from Dr. Waffle, and how that is important to us is people that need innovations have to go to an OR, either a Multicare or Franciscan CHI, and we need to have agreements in place for that. Sometimes we've had difficult time getting agreements. They'll also be discussing the PAM material updates. For those of us who've taken PAM a bunch, you'll realize that it hasn't changed a whole bunch over the last several years. A lot of the same scenarios, a lot of the same testing processes. That's going to change. Also, some dude named Adam Roslin is going to be interviewed to be an SCI, which is a senior EMS instructor. So he's going to be presented, and then we'll vote on him. So good luck to that guy. Fingers crossed. It's 50-50. The CQI is just a case of the month, and it rotates from department to department. So we don't know what that case is going to be yet, but it's always some decent learning points. Finally, the Ops Committee. There we will be discussing the MCI plan for scenes of violence and how it relates to our county and everything that we've agreed upon to this point. There's going to be an off-campus ED update, similar to what Chief Beckman gave. There'll be a discussion on the ER and WATRAC language, how it relates to EMS and how we can improve that. And lastly, a discussion on Ebola and other highly infectious disease transport plan.
I don't like that word.
Yeah, so that will take 4 hours. If there's something that you guys would like me to bring up to the meeting tomorrow or the following month regarding protocol or anything like that, please let me know. You guys know how to get a hold of me. Lastly, look for a large-scale MCI drill, first quarter or beginning of second quarter. That's going to involve some of our partners, Puyallup Police Department, Good Sam. We did a tabletop with them recently, earlier in the month, and learned quite a bit. We had a lot of our partners there. Ones I'd already discussed, Puyallup, Good Sam, Puyallup EOC, and Puyallup Police Department. It was a learning environment for all of us, and we hope to do more of those. If you want to be involved, please let me know. And that's basically it. I'm glad this wasn't live. I got through it without saying any cuss words, so that's awesome. If you have any questions, please let me know.